This is a hair tourniquet. A hair tourniquet is when a strand or two of hair actually gets onto the baby's little chubby toes or chubby fingers or sometimes even their penis and basically cuts off blood supply. Most cases occur in young children, particularly in infants that are less than 4 months old, because 90% of mothers actually experience excessive postpartum hair loss. When a parent brings a baby into the emergency room that is inconsolable, one of our first considerations is this diagnosis. Sometimes it's pretty easy to see that there's a problem. But sometimes it gets so buried in the inflammation and the swelling around the hair is so intense that it's just completely buried and there's just no way to identify the hair. Once it starts causing some local reaction, we can deduce that it's there. We can deduce that there's likely a hair tourniquet, even if we cannot identify the hair itself. Early treatment is key because as more time passes, the skin and tissue swell around the hair, making it harder to identify the actual hair, and it gets buried deep into the skin. And honestly, if this is not treated, it can lead to loss of function and amputation, so a prompt diagnosis is essential. So how do we treat it? Well, that depends on how much swelling is present and whether or not we can see the hair. Ideally, we would just simply unwind it, right? Using tweezers and maybe a needle. So if we can see the hair, we could try to lift it up and we can slide a blunt probe underneath and just cut it. We can also try depilatory like Nair to try to dissolve the hair. If the hair is buried and those other techniques are ineffective, then we'll have to cut. After performing a digital block and possibly sedation, depending on the child, to prevent pain, we'll use an 11 blade to cut longitudinally down the digit perpendicular to the hair, down to the bone, to ensure that we cut the hair fiber. So it's a big deal. So what I recommend is always check the baby's fingers and toes when you change their outfits. Check their penis when you change their diaper. Check them and make sure that if a baby is fussy for no apparent reason, that's kind of a hint or a clue that maybe there's something going on that's causing some pain in their body that maybe it's not immediately obvious. So start the investigation and check for a hair tourniquet.